right, well, research shows ADHD is on the rise in school-age children.
So joining us in studio with some tips is licensed psychologist Dr. Nicole Beurkens to offer some tips on getting properly diagnosed and tips to help soothe those kids during that process.
Yeah.
Good morning, good to see you.
Good morning, great to be back.
This is a big topic.
It certainly is, and the reality is a lot of families are going through this.
Absolutely. The statistics now are that almost 12% of children and teenagers in the United States are diagnosed with ADHD, and that is almost double what the numbers were even just 9 years ago, so it's a growing problem for sure.
And let's be clear, there's kind of variances on the ADHD, correct?
Absolutely. So there is the more inattentive type, kids who struggle with focus and attention in school, at home, maybe really disorganized, struggle with managing their time and things like that. Then there's the more impulsive, hyperactive kids who can be very impulsive with their decision making, all over the place physically with their behavior. And then there are kids with the combined type where they have both things going on. So certainly a wide spectrum of presentations there, but it's also important to note that inattentiveness and hyperactivity can be very normal depending on the age of the child and the setting as well. And so when we're looking at diagnosing a child, we're really looking at these kinds of behaviors that are inappropriate for their developmental level, meaning a toddler or a preschooler, very normal for them to be, you know, busier with their bodies, more inattentive, things like that. So we're looking at it in the context of what's developmentally appropriate and what's appropriate for the setting that they're in.
Okay, and you have kind of 5 key things that parents can kind of pick out when they're trying to, I don't know, go through the world figuring out what's going on.
Well, there's some underlying issues that are important for people to be aware of. Most of the time when people think of treatment for ADHD, they think about either medication or some kind of counseling or behavioral approach, both of which can be appropriate depending on the child. But I think it's important for parents to be aware that there are lots of underlying things to look at. Things like nutrient issues. We know that things like low iron or even suboptimal iron, magnesium, omega-3 fatty acids, when kids don't have optimal levels of those, they can exhibit very significant ADHD symptoms. Kids who eat a more heavily processed diet, full of chemical dyes, sugars, artificial sweeteners, those kinds of things. The research also shows that that exacerbates those issues. Sleep is a big one. Up to 40% of kids diagnosed with ADHD actually have an undiagnosed and untreated sleep disorder. So when they're not sleeping well, their brain can't function well. So these are the kinds of underlying things that parents need to be asking about and looking into if their child's exhibiting these symptoms.
All right, and you're going to stay with us, right, so we can talk to you in the 7 o'clock hour?
Absolutely.
We have a lot more to get
We
into.
certainly do, and I'm sure parents at home are like, tell us more, so make sure you stick around. She'll be back on at 7:40, but if you want to get in touch with her yourself, there's that information. So we'll talk to you soon. Thank you.
Fantastic.
Yep.
All right, it's 6:49.
Well, more